Hi friends, this is Dr. Abdequaem Chimthanawala. Today I will discuss a very rare case that came in my practice, and I learnt a very rare remedy when I prescribed for this case. The patient came with head in motion like this. So he had a problem of shaking head. Now shaking head from side to side and sometimes shaking head from back and front like this, sometimes like this. So when he came, I asked him, say, whether the motion is in a particular fashion or it is like this. So he told, sir, it is like this sometimes and sometimes it is like this, depending on my stress level, depending on whenever I have anxiety, whenever I am panicky, whenever I am fearful, the shaking increases more. I have tried lots and lots of medicines. In the past 2 years I have the same problem. Now whenever you have a problem of shaking head, 2 remedies you have to remember which are very commonly used in a practice, and that is Bryonia and Sepia. Now with this symptom, the patient definitely was suffering from a lot of inferiority complex, a lot of embarrassment, a lot of anticipation, a lot of anxiety, a lot of reservedness. He had become reserved, introvert because of this head shaking. He said, I cannot go in public, it looks very odd, sometimes the people laugh, and sometimes people give me a lot of advices, go here, go there, and I am also going everywhere, but there is no result. So after taking the case, the whole symptom were this only, like anxiety, anticipation, everything the same, and he had tried a lot of other medicines without avail. So when I took the case, I asked him symptoms more than this, can you add something more which you have never told? So it said, no sir, the only thing is that please cure this, and I have a problem and I have a lot of fear, anxiety, embarrassment because of this. Now these are all symptoms common to because of what the patient was suffering from. So I said something more. So again, one symptom the patient told that because of this I have started hating myself. I don't like myself only. When I see in the mirror, it looks so odd, and I started hating myself. I don't like myself. Now this was a very important symptom the patient narrated. I said something more you can add, any dreams you have? And he said, sir, I have dreams but I don't remember anything. So he had a lot of dreams but he does not remember any of the dream. I said, since 1 or 2 years or 6 months you must be having some dream. Any one dream you remember? So he said, sir, I have a lot of dreams but I don't remember. So this was the patient's wording. I said something else also. You have some fears, some anxiety. He said, sir, I cannot go swimming. I have fear of water, and that is a very important symptom which I thought, because he had this symptom before also. And he said, sir, I feel very guilty. I feel very embarrassed that if I have to go to my son's school, I cannot go because I have this problem. So I feel very bad that I cannot do anything for my children's. This was his wordings, and he was very emotional when he was telling that. And I said, sir, anything else you want to add? How are your stools, urine? And so he said, everything is fine, but sometimes I feel that when I am passing stool, the anus is coming up. There's a spasm when the anus comes up. Sometimes I feel this is a symptom, rest symptoms I have told you. So this was a case in front of me, a very a case spoiled by a lot of medicines, a case treated with a lot of medicine but with no relief. Now if you see the whole case, the patient has given very few symptoms which you can repetize, but now you have to, as I always say, you have to convert the patient's language in the repertory form. Now if you see the symptom of rectum, constipation or rectum, he feels that anus sensation as if the anus is drawn up. Now this is a symptom which I thought is maybe present in our books, but when I saw the remedy, it was Idofom, which had the symptom but it did not cover any of the symptom was the patient was suffering from. Now if you repetize this case, a very important repertory symptom you have to use in order to get the remedy. So the symptom which I took for repetization was definitely motion in the head, shaking the head, motion to and fro. And what was the patient trying to tell us? That he does not like himself, hates himself because of this. This I took rubric was, any guesses? This is called aversion to himself, aversion to herself. This is a very, very important rubric, which is patient is going through a state where he does not like himself. That becomes a very important symptom for our prescription. Next, so many dreams he has, but he cannot remember. So simple rubric, you can take dreams unremembered, and of course the fear of water. And the embarrassment, or he feels guilty that he cannot do anything for his children, cannot go to the school and be with them in their functions. So I took the rubric anxiety of conscience. And of course the symptom with the patient told that anus feels drawn up. These were the symptoms in front of us, in front of me. Then I tried to repetize this symptom. Now imagine a condition where the patient is coming to you with a very rare symptom. So you have to be very sure that when you repetize this case, you take appropriate rubrics so that the remedy which comes on the first dose, you must give free to the patient, because as such the patient is so tired. If you also take a lot of time, he'll leave you and go somewhere else. So it is very important that your rubrication has to be precise in order to arrive for a remedy. So all this fit in the repertory chart: motion in head, back and fro, motion in head, shaking head, aversion to himself, dreams unremembered, fear of water, anxiety of conscience. If you repetize this rubrics, my friend, a very, very rare drug came into my repertory chart, which I had never used before. Let me be frank with you, I had never used this drug before, but after this I've started using this remedy with good results. The remedy which I am talking about is Spiraea. Yes, this is Spiraea Ulmaria. Spiraea, Spiraea Ulmaria, Ulmaria. Spiraea Ulmaria 200. I repeated an interval of 15 days, twice. After a month's time, the patient came to me and said, "Sir, I am only 20% better." But definitely when I had to go for a major work, before that normally I has to get a lot of shaking in the head, but this time the shaking was better, at least 20%. This is how the remedy worked. In a course of about 8 to 10 months, gradually the symptoms tapered off, and in 10 months he was totally cured with his complaints. Spiraea Ulmaria 202 doses. And of course, if you repetize the symptom sensation as if the anus is drawn up, you will get the remedy Spiraea. This is Spiraea Matremedica for you. These symptoms I have seen in the patient, so it will definitely work if your patient is suffering from this type of symptoms. Apart from this case, I have read this remedy and I would like to add few symptoms which are very important so that you can use this remedy when these symptoms are also there. A very important symptom is wounds and bites. Dog bite, rabbit bite, snake bite, all the bites are covered by Spiraea. This symptom is a very important symptom of Spiraea because we never think of this remedy of complaints related to bites. And one symptom related to sexual functions is sexual desires increased in the morning when he's in the bed. So whenever you have these two symptoms apart from the case, think of this remedy. The first symptom, wounds, bites, dog bites, rabbit bite, snake bite. Second, sexual desires increased in the morning in the bed. This is Spiraea from you, my friends. Go home, read again and see this video 2-3 times so that you can understand what I am telling you, understand the symptoms for which I have prescribed Spiraea, Ulmaria. If you like this video, do share and subscribe so that lot many doctors can learn something about Spiraea. Thank you.